Hi, I'm Ron J. Rackett. I'm here today to talk about infection prevention. And I first wanted to start with good hand washing. And so everyone's worried about infection prevention these days, and you know I wanted to kind of focus on some finer points on hand washing and making sure that you guys do the right things. And first off, we wanted to start with if you can get some warmer water, that'd be preferable. Getting an adequate amount of soap, but you don't have to have an excessive amount, just enough to cause warm, enough to cause suds and soapy bubbles, because that soap will break apart the virus membrane and kill the virus extremely effectively. Obviously, everyone's talking about 20 seconds. We all know that from the CDC, but we want to make sure we focus on washing between the fingers as such. We want to make sure we pay close attention to the nails and nail beds and underneath the nails. Also for nail hygiene, keeping very trim nails, avoiding chips or cracks in the nails, avoiding rings. And if you have a ring, you can take it off and wash and then put it back on. The back of the hand is obviously often neglected, and the area between the thumb and index fingers obviously is also very neglected, and the thumb in particular is obviously neglected, and washing those areas. And the nails, there's a variety of ways to wash underneath your nails. Before surgery, we take basically nail files and go underneath each nail. So you don't have to do that, but you can wash as such underneath the nails like this to get a nice good lather underneath and get that into underneath the nail beds. Or you can kind of take your finger and go underneath each nail bed as such, and then rinsing off will rinse all the dead viral particles off of your hands. And the next step is really important, which is not reaching immediately for the faucet handle, but getting the paper towel out, drying your hands, because if you have wet hands after you wash your hands, then you touch a surface, then you automatically have exactly whatever's on that surface on your hands. So it completely defeats the purpose, not drying your hands very well. Some people will even kind of air dry. Surgeons will do this sometimes, air dry. And then shutting off the faucet with your paper towel, and then properly disposing of the paper towel in the trash with your feet. And then I wanted to spend a moment on the mask. The masks are obviously important if you're going to be within 6 feet of someone. Social distancing requires us to be 6 feet away, but keeping the mask, in an area where it's not going to be on a surface is important. You want to handle the mask with the loops, not by touching the mask, either touching the outside or inside. You want to handle the mask with the loops. You want to put one ear on first and put the other ear on, and you want to fold the mask here and pull the mask down with your loops, trying to avoid touching the mask here as much as possible, because as soon as you touch this area, you contaminate the mask. And then you want to also make sure the mask is very well fit with the nose, metal wire really approximated to your face. And when you do take it off, you want to take it off with the loops, not grabbing the masks. Whoops. You want to take it off with the loops, and you want to put it, if you are going to reuse it, although these are single-use masks, but if you are going to reuse it, you want to put it somewhere either like in a brown bag or somewhere that's on the surface, not where you're going to get it contaminated. Thank you very much for your time, and stay safe and healthy.